I think this is the second time we've gotten out of the WHO. Is that correct? Or
I think that.
I think it's the second time, or at least Trump already threatened one time to get out of it. But I'm almost certain that we got out of it for the second time. Okay. What's insane about the WHO is that United States pays a due to be part of the WHO.
A big due,
A
correct?
big due, yes. 18%. Yeah, exactly. 18% of the budget of the WHO comes from the United States. So we essentially pay the WHO a fifth.
Customers.
Yeah, we're pretty much the most important customer that the WHO has. And the way the compensation works is it's based upon GDP. But then you take, for example, China, which has probably 2 or 3 or 4 times as many people in their population, they pay a fraction of that.
How much do they pay compared to us? You know,
Let me see. I
I
think
want to say it's like we pay like 5 billion or something like that, and they pay like
yeah.
1 or something.
On Trump's term, I was watching a video by Trump. He said that he negotiated to bring it down to 39 million per year, and then when Biden came back into the government, they brought it back up to 5,000 million, which is 5 billion.
Yeah, that's what it wasn't. Yeah,
Yeah, it's a lot of money. I'm trying to figure out.
I don't remember. It was a lot too little. I remember that.
No, it's like, what the hell are we paying that much money for nothing?
What do we even get for paying that money? Out of curiosity.
So technically what the WHO does is you got access to everything that's happening health-wise around the world. So let's say, for example, COVID breaks out in China. The role of the WHO is to tell the United States, hey, there's an outbreak in China. This is what we're doing to stop it from
Doesn't the media do
Which
that?
is where they failed us.
which is what
in
failed
the COVID pandemic.
and that's why Trump said we're getting out of this thing because you guys are in charge of that and you guys did a terrible job at making sure that COVID didn't spread out like it did. So that's one reason. The second reason, which I read it multiple times, is that the operational costs of the WHO, just admin costs, are super high. The salaries of the people that that are part of the administration of the WHO are super high. They're based out of Geneva, extremely expensive city. So most of the money that these countries are paying for policy and making sure everybody is safe, it's pretty much going towards operational costs. It's like Susan G. Komen, right? You're donating all this money, yet only 5 cents of your dollar go to the actual research.
That's so true for so many health things, isn't it?
There's a lot of corruption in health. I mean,
Totally. And the last thing that I can remember that they were like touted for was their leadership in eradication of smallpox, which was a great success for them, but that's also before my time. What are we doing right now? And like I said, they had a chance to step up with COVID, and instead they brought information to us slowly. They had vested interests in
and when they did the United States wanted to figure out, did COVID actually come from a bat, right? Or did it actually come from a leak from a lab in Wuhan?
Mm-hmm. I remember that conversation.
And while the WHO it's not their job to go in there and get all the information from government. That's their role. They should be able to go to countries and get participation from the government to figure this out. So when they did the report, was it leaked from a Wuhan lab? They didn't have solid information that they needed. And I think the United States just issued like a 500-page document not too long ago that said that it most likely came from a lab leak in Wuhan, China. So the WHO essentially failed. Essentially, the WHO failed to do its job, right? And like he said, we're spending all this money, right? Millions of dollars, and we're not getting much out of it.
No, yeah, and one of the possible benefits from stepping away from the WHO could be that opportunity for more decentralized, localized approaches to healthcare. So
that's very good.
In that way, it's exciting.
Yeah, and can
you break that down a little bit for people? Like when you say like more localized, decentralized, like what does that mean? Like in real practical terms to everyday
we get
taking a global concern. Which is kind of what the WHO is doing. They take it from a global perspective, and we all kind of react to certain things. And going in North America, these are the things that they struggle with, and these are where we need to put our importance. This is where the research needs to be, even more than that. In Florida, this environment is such that breeds this, and this, and these are the things that pop up in Florida compared to Washington.
Yeah, we have different
And,
issues.
so having these different avenues to research and bring healthcare, focus our healthcare in ways that we need it in our region. And now you also can look at other countries.
You guys say all that to the mic.
What happened?
Who will be in charge of setting that up, do you think? Like so I think sometimes people are like, well, if the WHO doesn't do it, who who will?
It has to be. I think it has to be HHS, right?
I mean,
Is in charge of leading that, right?
It doesn't mean that we can't come up with a new body that
I think-
regulates it in a different way.
Man, I think it's a great point of view. What you're saying, it's like we have the WHO handling disease and chronic illness and infectious diseases on a global perspective, but our main focus is it malaria in the United States?
Right.
Right? It's not.
Makes
it's
sense.
chronic illness. What's the
It's your gut
conversation? It's gut health. What we're eating. Our issues are totally different than the issues that Africa is struggling with. It's a different issue than what's happening in China. So, I think what you're saying, it's like on point. I'm going to nominate.
Potentially open the door to alternative approaches to healthcare and emphasize that holistic preventative care here where we need it.
Yep.
Because this is not this standard American diet or the SAD diet is not anywhere but here in America. They're not eating this way in Europe. This is just us.
I bet that their food pyramid looks a lot different.
Yeah.
Which, by the way, our food pyramid dated.
Very dated.
I heard a doctor that say, if you want to look like a pyramid, follow the food pyramid.
That's funny. Wait, so you said HHS would cover
It has to be.
What is that? What would that look like?
That's a great question. That's up to RFK to do it. Hey, I supported him. I love the policy about chronic illness. So now, how are we going to do it? That's your problem. Now you're going to tell me how to do it.
These are very
Or what is he going to tackle first, right?
Yeah.
There's a lot to tackle,
Big
unfortunately. Yeah, that's a lot to tackle. I think.
What would you tackle first?
I mean, I've said it a few times. Let's start with. We just need a little bit of traction, right? Let's sign an executive order where let's ban pharmaceutical companies from advertising on TV. Make a list of ingredients that we need to ban from food. Simple. We're not going to do this anymore. And then let's figure out chronic disease epidemic. Like, what are we doing currently that is not working, and how do we shift it? So I think what we talked about Medicaid and Medicare, I think there should be a shift on covered versus non-covered services moving forward. Like, because I was watching a podcast from a medical doctor from Puerto Rico. He's very well known. He's been in the Senate as well in Puerto Rico, and he used to work in a research department where they look at different treatments and drugs for different diseases. And what he was saying is there's certain treatments that are more effective at curing certain diseases or treating certain diseases, but because other methods, they've invested so much money in them, it makes more sense from an ROI perspective to proceed with the one you spent a lot of money versus the one that you haven't spent a lot, so you can get your ROI back. So a lot of these treatments that are being covered by Medicare, Medicaid, or are covered by insurance, they might not necessarily be the most effective one, but it's the one that we spend the most research and money on, and we need to get an ROI back. And again, I'm not making this up. This was this doctor from Puerto Rico.
And often preventative care, such as chiropractic care, is not covered.
Might not be
well.
covered, yeah.
not covered usually at all.
Yeah. I mean, because when you talk about chronic disease, you're not talking only about cancer, heart disease. You're talking about chronic pain as well. You think about chronic back pain is the number one cause of disability in the United States.
So basically, people who really truly want to be healthy, they have to take money out of their own pocket, not only for preventive care, but for healthy food. What do you tell people who are like, I don't have money for that?
You know I don't know where, I think it was in one of the hearings, the RFK hearings, he brought up an idea about giving, on top of Medicare and Medicaid, giving people HSAs. And HSA, it's a great idea because it could be tax deductible, but then you can use it towards healthcare expenses that might not be fully covered by insurance, such as chiropractic care or a functional doc or massage, whatever you want to call it. Imagine if we could get also an HSA. I don't know how they're going to do it tax-wise, but there's money that you take from your paycheck and you put in the HSA, but there's a lot more people that can get it. Not only the people that have a high premium, low premium, high deductible insurance plan. Because right now, based on the law, the only people that can get an HSA is the people that are paying a low premium, high deductible plan, which essentially means that you're paying a smaller premium a month, but your deductible is very high, meaning that before insurance covers, you got to spend $7,000. And the reason you have an HSA is so you can cover the $7,000.
Genesis, I want your perspective on this, on you're buying groceries for your family, doing things like this, spending money on, you spend money. I know you guys, you're a chiropractor and stuff, and obviously you can get chiropractic care, but I know you spend money on other natural health solutions all the time, right? What would you tell and I'm sure you talk to your patients about this, is like, what do you tell them about investing in their health and spending money on that stuff, even when it feels like you don't have the money to do that?
That's a tricky question because I mean, unless someone comes in and like really asks me like, hey, what do you do? But I personally just tell them really what I do. I don't have necessarily a primary doctor. I do, get chiropractic care. That's my doctor. Say I have to get some labs done, I can get that done. One of these doctors can read them. If there's something out of the ordinary, I'll go check it. But I mean, things that when I say I wake up one day, I'm like, I don't care, I'm just going to go for it. I literally go, and say insurance is a scam, and tell them, because to me, you were talking about the HSA, and I think for tax reasons, that's what we have. And that's money that later on you can use, right? Right now, I feel like families dumping hundreds and hundreds and hundreds of dollars in money that you won't see, you cannot use. And yes, it's frustrating. So sometimes, I mean, I don't want to sound irresponsible and tell people, hey, like, don't get insurance, because I know, like, you want that secureness. Something happens.
If you get in a car accident, it can come in very handy.
Yeah.
Right. Which, by the way, speaking of car accidents, our car accident, we have really good car accident insurance for car.
And it was bad.
Huh?
It was bad.
And then it was bad. But I mean, if you're going to spend money on something, well, you know how it works in Florida. Oh yeah. It's better to get into a car accident, hit a tree, than actually rely on your insurance, on your health insurance. Yeah. And those are conversations that sometimes, I mean, again, I'm not going to go out of my way and talk a patient into it, but I'm like, hey, I do acupuncture, 2-3 times a year. I get massages constantly every 2 to 3 months, depending on how I'm feeling. I get chiropractic care. I eat healthy. And there's this thing
all that costs money, though.
All of that
out of your pocket.
It costs money. But here's the deal, right? Let's assume I told everybody I think everybody should get a chiropractor and should do some sort of chiropractic. You don't have to go to my office, right? Which is more concierge, more specific. We're taking X-rays. You can go to a joint. A joint is a walk-in clinic for a very minimal fee. You can get a few adjustments in there. It might be
even if you only go once a month.
Even if you go once a month, it's not a lot of money. It's literally $2 a day. And you can get one adjustment at the joint and you're good to go. So you don't have to go to these places like ours that are specialized. You can go to a walk-in clinic, and that's good. You're doing something about. What we need is people to do something about it, not just sit in their couch like, I'm broke, I cannot do anything.
But you're prioritizing I cannot go into, like, everyone has different priorities. I can sit down with you and it's like, let me see the car that you drive. Let me see the house that you have. Like,
oftentimes it's not that they don't have money, it's how you choose to use the money.
Right.
It's how you choose to use it.
But
most
if
of the time,
feel better, sometimes you actually have opportunity to make more as well.
To make more money, yeah, absolutely.
But you gotta initiate something.
You gotta put a little bit in it, invest. You gotta invest in our health, and that's another issue we have in healthcare. Is we don't take responsibility.
And oftentimes you see people, unless something really tragic happens to them, that's when you really see people forget it. I'm never doing this again, right? And somehow your life changes, and you have a different perspective of what's actually important in life. But why do we have to wait till something like this really touches us to see, like, let me write down everything that is important to me and really what matters right now?
It's so good because the pain really does have to be greater sometimes. So sometimes, like you said earlier, you said, oh, people just eat whatever they want to eat. And they're like, I look good, I feel good, until they get a diagnosis.
Happens, yeah.
And then all of a sudden it's like, oh, maybe I'll change the way I eat. You probably run into this all the time with your patients, Dr. Vincent.
Oh, I do. I kind of always will ask them who feels healthy, and I'm looking at them, and they have all of the stereotypical signs of metabolic syndrome, and ultimately I'm like, you're sick.
Yeah, you're sick.
They don't like that, by the way. They don't like that, the idea that they walked in healthy and they're walking out sick. But once again, I'm providing you with some information that allows you to make choices for your life. I will support the choice you make because it's your body. But if I didn't give you this information and if I didn't explain this to you and you kept making the wrong choice, not realizing you had other choices, then that's my fault.
Zach, my husband, always says it can be hard on the front end or the back end. You can spend money on the front end or the back end. Having cancer is going to be really expensive on the back end. Going to the chiropractor, going to acupuncture, eating good food, it's going to be more expensive on the front end, but you get to decide.
Exactly.
Is that how you guys live too?
That's how we do it. Yeah.
I
It's
mean,
a little bit more expensive, but
I can ask any of those same people, how many cable subscriptions do you have? They're paying monthly for Netflix. They're paying for their HBO. They may have Sling for their cable. They like news, so they have their Fox apps or whatever. And you total that up. And these are a total monthly expense that keeps you sitting on your couch.
Right.
Take that and convert it to something like using that for chiropractic that encourages you to get out in the world, to get out in the real world, the sun, see other people, real people. They don't have to be digital on your screen. They're really out there doing stuff. We need to get back there. It's crazy though. I mean, I'm guilty of it. I probably have 6 different TV services.
we gotta make choices, you know. And for example, Spectrum, having your Wi-Fi in your apartment is gonna cost you about $50. A gym membership at Crunch Fitness here, it's $10. Can you not do Wi-Fi for your apartment? Just use your cell phone hotspot,
Or not have cable.
and then just and then use that money towards either going to Crunch Fitness or whatever your
Or
gym,
Netflix.
right? Or using something. You have choices.
And
So-
and sorry to interrupt, but you're talking about the gym and stuff. Like, I feel like us too, especially me, where we spend most of our money, number one is food.
Oh, for
Number two is it's our gym and our trainer.
your fitness.
That's
Yeah,
literally
I
like top 2
literally do
expenses.
personal training, but I know me. I'm one of those people. I had to wake up at 4 a.m. and be at the gym at 5 because that's the only time during the day that I can actually do it. But not just that. I know that I need an accountability partner. Otherwise, I can have the Crunch Fitness. That's me. LA Fitness, Crunch Fitness, Sport, or whatever the name is, and I won't go. But I need someone. I mean, I wish I could have that, mentality of I'm gonna create my own workout and I'm gonna go for an hour. That's not me. And I've been doing this with my trainer since July, and I look at the monthly expense and I'm like, oh my gosh, this is how much I'm spending. But I see it as that's the best investment that I'm doing. I don't care. 500 total a month, whatever. I'm just putting a number, but that's the best money that I'm investing in my health.
But that's a paradigm shift.
That's another paradigm. You see,
It's all about how you think.
it's how you think, because again, our belief systems fuel our actions, and our actions fuel our results, and our results reinforce the belief systems.
Somebody's going to be listening to this and they're going to say, but you don't understand. You make more money than me. I don't have that money. What do you say to them?
Being healthy and making health decisions, this is just one part of health, what we're talking about. Going to a gym, doing chiropractic care, but it can be as simple as you drink better water, you walk outside, you move, you can make better choices.
Don't stop what you can't do, keep you from what you can't
Exactly.
I mean, I would never forget when I met you guys, you and Zach and Jake, and that you guys will go to the beach in the middle of the week just because one, it's not as crowded. Two, you have the time. That's let's say Monday is your day off, but you're getting sunlight. You're out there. And I mean, it's as simple as you can start somewhere, right? Like go on a walk.
Just
That's
do
free.
just do
Go on
something.
a walk. The sun is out. 30 minutes, 20 minutes, do something. Start somewhere.
Spend the $5 that you spent on the prepackaged item
Start
on a
somewhere.
non-prepackaged item.
Yeah.
And it's also just putting forth the effort to be aware. Doesn't matter what your income level is. You're sending your kids to school, and if you're low income, you're probably on some sort of a school meal plan. But when you look at what the schools are offering for food, you're not putting better options in front of your kid anyway.
Yeah.
You know, and that's something that doesn't have to be extra and out of pocket. You just have to get to your school's board and you know, start requesting or putting out there that we want better options.
Educating your kid on, hey, if you have a choice between an apple and whatever, pick the apple.
Pick the apple.
Well, and that's why I like that color system he's got that I think RFK was talking about, where they will have color labels, and it's like, I want you to eat. You can eat things that have the green and the yellow label. You can use much of the green and yellow, but you don't eat any of the red label items.
Yeah,
and now kids just have to go, okay, wait.
And eat only one orange.
Sure, absolutely.
There's a trend out there, if you guys can look it up on Instagram, I'm sure TikTok too, where I see moms with their kids at the grocery store, and the kids are grabbing, it's like a game that they're making, turning around, and can you read the ingredients? And the kid definitely can't. He's like, okay, so this is something, and then you'll ask the kid on the next box that they grab, Mommy, we're not grabbing it.
Isn't that our paradigm shift?
That is. It's a third grade reading test.
Cool.
If you can't read it, don't buy it.
It's as simple as that.
It's
and the
education.
kids are like, no, Mommy, we're not putting it in. And it's a game. But then you're teaching them early, hey, you need to know what you're putting in your body.
And anybody can do it.
Everybody can. It's spend a little bit of time in education. If you educate the kids nowadays, they'll make better health decisions in the future.
But our paradigm shifts are going to change and shift the paradigms for the future.
We might not be able to see it. I mean, we're starting right now with RFK. Most people that be in the healthcare industry, when they saw RFK getting nominated and confirmed, they were so excited because they're like, I thought I would never see this in my lifetime. We might not be able to see the change in the chronic disease epidemic, but kids like Jake might be able to see it, right? Or my kids will be able to see it because we actually did something about it now, and now we're going to see the benefits 30, 40 years from now. I mean, it's the same thing how we got here, right? 40, 50 years ago, some people decided to make the wrong decisions, and now we're paying for them, right? And 30, 40, 50 years from now, if we actually do something right now, we might be able to get something better out of it.
Awesome.
I think it's a crucial and pivotal moment in history when it comes to health. This is the moment where we have to change that paradigm.